Hello, everybody, and welcome to PathoLogic. Today we're going to be discussing cardiac dysfunctions and heart failure. The major role of the heart is delivery of the blood to the tissues. Any abnormalities or alterations in the heart's structure can impair delivery, which is what we call heart failure. There are 5 main mechanisms that can cause heart failure, and they are obstruction of blood flow, regurgitant blood flow, blood shunting, myocardial disease, and cardiac conduction disorders. The last one we will not cover in this lecture, but it will probably be a topic for a future lecture on this channel. We will start by discussing obstruction of blood flow. Blocking blood flow increases resistance within the cardiac system. Increased resistance means that the heart has to produce a higher pressure in order to bypass that resistance. To create higher pressure blood flow, the cardiac muscle must work harder. This results in concentric hypertrophy. Concentric hypertrophy refers to the thickening of the muscular walls in order to increase pressure output. The individual cells in the muscle get wider rather than longer, resulting in a thicker wall. The lumen of the ventricles also becomes smaller. The thicker wall is more prone to ischemia, eventually leading to fibrosis and poor diastolic filling. The first cause of obstructed blood flow to discuss is semilunar valve stenosis. This involves narrowing of the semilunar valve entrance or the valve itself. This prevents adequate outflow from the ventricles because there is now a very narrow opening for the blood to try and squeeze through. To try and force more blood through the stenotic valves, the heart develops concentric hypertrophy. Pulmonic stenosis is most common in dogs. This can either be due to a fibrous or muscular band beneath the valve, or a malformation in the valve itself. This causes concentric hypertrophy of the right ventricle. Subaortic stenosis is the most common congenital cardiac anomaly occurring in large breed dogs. This condition is usually caused by a thick fibrous tissue band below the valve. Again, this results in concentric hypertrophy of the left ventricle. Another potential cause of obstructed blood flow is hypertension. High blood pressure can basically prevent blood from leaving the ventricles due to the high resistance. To overcome that resistance, higher pressure is necessary to push against that high blood pressure. Again, this would result in concentric hypertrophy. Causes of pulmonary hypertension include high blood volume due to structural cardiac abnormalities, or things that would obstruct blood flow. Common causes of obstruction include heartworm disease and pulmonary thromboembolism. In heartworm disease, for example, the worms actually block the blood flow by sitting within the pulmonary veins. Both high blood volume or obstruction will result in concentric hypertrophy of the right ventricular wall. This is sometimes called cor pulmonale syndrome, where cor means heart and pulmonale means lung. Systemic hypertension is primarily due to endocrine or renal disorders. Potential causes include hyperthyroidism, hyperadrenocorticism, diabetes mellitus, pheochromocytoma, or renal failure. Systemic hypertension results in left ventricular concentric hypertrophy. Next, we will discuss regurgitant blood flow. Regurgitation is basically when a fluid goes back in the direction that it came from. Since the heart was designed to be a one-way system, regurgitation can be problematic because it results in more blood volume in an area than typically expected. This stretches out the lumen of that cardiac chamber, and we call it eccentric hypertrophy. Eccentric hypertrophy looks like thinner cardiac walls than you would expect. However, it is still hypertrophy because the cardiomyocytes do actually get bigger. They get bigger by increasing their length, which therefore increases the length of the cardiac wall and thus increases the lumen size for that cardiac chamber. Eccentric hypertrophy also reduces ventricular contraction force, which can affect cardiac output. A common cause of eccentric hypertrophy is atrioventricular valve insufficiency. In this condition, Failure of the atrioventricular valves allows blood to flow back into the atria during ventricular contraction, resulting in excess blood within the atria. You can also see excess blood entering the ventricles during their relaxation phase. Therefore, AV valve insufficiency typically results in eccentric hypertrophy of both the atria and the ventricles. A common cause of this is myxomatous valvular degeneration. This is the most common cardiovascular disease in dogs. It is an age-related condition resulting in thickening or nodularity of the atrioventricular valve cusps. It can affect either AV valve or both of them simultaneously. The nodules or thickenings prevent the cusps from forming a complete seal, resulting in regurgitation. Endocarditis is a bacterial infection affecting the valves. It typically forms vegetative or cauliflower-like masses that prevent a tight seal. This condition most commonly affects the mitral and aortic valves, but it can affect any valve. We most commonly think of tricuspid valve dysplasia as a genetically inherited condition in Labradors. This is a congenital disease resulting in shortening or rolling of the valve leaflets. This results in insufficiency of the valve and eccentric hypertrophy of the right side of the heart. A similar condition can occur in the mitral valve. Mitral valve dysplasia usually occurs alongside other structural abnormalities within the heart. The shortened or rolled valve leaflets result in eccentric hypertrophy of the left side of the heart. However, depending on what other abnormalities are present, this eccentric hypertrophy may not be super obvious. Finally, we have semilunar valve insufficiency. When the semilunar valves fail to form a tight seal, it allows backflow of blood into the ventricles during their relaxation phase. This causes the ventricles to fill excessively, resulting in eccentric hypertrophy. The most common form of this is aortic insufficiency in older horses. Aging results in degeneration of the valve, causing it to become nodular or holy. This results in eccentric hypertrophy of the left side of the heart. The next potential cause of heart failure to discuss is blood shunting. Shunts are openings that allow blood to go places that it wasn't supposed to. Because this results in too much blood within an area, it typically causes eccentric hypertrophy. That hypertrophy occurs in the area where the blood ends up after going through the shunt, not where it actually originated from. Ventricular septal defects are a relatively common shunt in our veterinary species. These are essentially holes within the interventricular septum due to incomplete development of the septal wall. With these defects, blood shunts from left to right as the blood pressure in the left side of the heart is higher. This results in eccentric hypertrophy of the right side of the heart. Atrial septal defects result from failure of the foramen ovale to close. This is a normal structure that allows fetal circulation to bypass the lungs. If it remains open after birth, it causes left to right shunting between the atria, resulting in eccentric hypertrophy of the right atrium. The ductus arteriosus is another normal structure in fetal cardiac circulation. It is a short connection between the pulmonary trunk and the aorta that also helps with bypassing the lungs. If it remains patent after birth, blood from the aorta enters the pulmonary circulation due to the higher pressure within the aorta. This results in volume overload of the left side of the heart, as that excess blood entering the lungs eventually works its way back to the left side of the heart. This results in eccentric hypertrophy of the left atrium and ventricle. Finally, we have Tetralogy of Fallot. This is a congenital condition characterized by 4 hallmark changes: pulmonic stenosis, ventricular septal defect, overriding aorta, and right ventricular hypertrophy. We will discuss each of these and how they contribute to this condition separately. Pulmonic stenosis results in little delivery of blood to the lungs due to the very narrow opening. Consequently, the heart develops right concentric hypertrophy to try and increase delivery of blood despite the resistance that's occurring from the pulmonic stenosis. The combined effect is increased pressure within the right side of the heart. These hearts also have a ventricular septal defect, which reduces the pressure in the left side of the heart, thus making it nearly equal with the stenotic right side of the heart. This results in shunting of blood from right to left, which is very unusual for most blood shunting conditions. This allows deoxygenated blood from the right side of the heart to enter the aorta. Additionally, the size of the ventricular septal defect in this condition often creates what's called an overriding aorta. This is a condition where the aorta basically receives blood from both ventricles during contraction. This worsens the deoxygenated blood entering the aorta. Ultimately, the major consequence of this condition is poor oxygenation due to blood bypassing the lungs. In human medicine, they often refer to these patients as blue babies because they do develop cyanosis due to hypoxemia. Tetralogy of Fallot is most common in humans, but it can occur in our domestic species as well. English bulldogs and caissons appear to be particularly predisposed to this condition. Our final cause of heart failure to discuss is myocardial disease. The muscle within the heart walls is what makes up the pump that keeps blood flowing. Failure of this pump can result in poor arterial blood pressure, poor cardiac output, and inadequate emptying of the ventricles after a heartbeat. This is sometimes referred to as systolic heart failure, as systole is the contraction phase of the heartbeat and is most commonly affected by myocardial disease. Potential causes of myocardial disease include myocarditis, certain toxicoses, and cardiomyopathies. We will discuss the two main cardiomyopathies that occur in veterinary species. Dilated cardiomyopathy is a condition primarily affecting large breed dogs. It can be inherited or due to cardiotoxicity. Recently, it has been associated with feeding grain-free diets. Dilated cardiomyopathy results in eccentric hypertrophy with dilation of the ventricular lumens. The eccentric hypertrophy in this condition occurs due to a primary issue within the myocardium, which results in inefficient ventricular contraction. Due to inefficient ventricular contraction, there is incomplete ventricular emptying. Ultimately, that blood is going to back up into both the vena cavae and the lungs, causing congestive heart failure. Hypertrophic cardiomyopathy most commonly occurs in cats. It is believed to have a genetic component, and there are also breed predispositions that have been described. It results from a defect in the cardiomyocytes themselves that causes them to hypertrophy. This condition results in bilateral concentric hypertrophy with thickening of the ventricular walls. The thickening of the ventricular walls in this condition also causes narrowing of the ventricular lumens. The small lumen reduces the blood available from each heartbeat, resulting in inadequate delivery of blood to the tissues. There's also not enough blood moving through the heart, resulting in blood backing up and causing congestion. Now that we know how heart failure can happen, we can discuss the potential consequences of heart failure. Heart failure is defined as the inability of the heart to meet the blood and oxygen demands of the tissues. It can either be left-sided, right-sided, or bilateral. Each type of heart failure has different consequences for the rest of the body. The right side of the heart pulls blood out of venous circulation and delivers it to the lungs. Therefore, when the right side of the heart fails, blood backs up into the body's venous system. This results in things like distension of veins, edema, and passive congestion of the liver. Nutmeg liver is the term for the prominent lobular pattern that is characteristic of passive congestion of the liver due to heart failure. This pattern occurs because the central lobular veins, which are in the middle of each hepatic lobule, become congested and dilated. The periphery of each lobule becomes hypoxic because the congested blood doesn't deliver a lot of oxygen. In response to that hypoxemia, those cells accumulate fat, making them quite pale. When you combine these two effects, you see a prominent pattern in the liver that looks like the cut surface of a nutmeg. The veins are not meant to resist high blood pressure, so they are commonly affected by right-sided heart failure. What happens is that there is an increased blood volume within the veins during this congestion process that then increases blood pressure, resulting in more fluid being pushed out of the vessels than normal. This can cause several fluid-related problems, including peripheral edema, ascites, and pericardial effusion. When it comes to the left side of the heart, remember that this part of the heart retrieves blood from the lungs and delivers it to the body. Therefore, when the left side of the heart fails, blood backs up into the lungs, resulting in pulmonary edema. Left-sided heart failure can also result in poor delivery of oxygen to the tissues. Of all of the tissues, the brain is the most oxygen dependent, so left-sided heart failure can cause syncope or collapse due to a lack of oxygen reaching the brain. Pulmonary edema is basically passive congestion of the lungs. Similar to passive congestion elsewhere in the body, the high venous blood pressure results in fluid leakage into the surrounding tissues, or in this case, into the airways. This results in tachypnea and dyspnea as the animal is trying to breathe through the fluid. Some animals will also develop cough and exercise intolerance due to left-sided heart failure. When animals develop bilateral heart failure, they typically show clinical signs and lesions of both right and left-sided heart failure. Frequent findings include lung and liver congestion, ascites, peripheral edema, tachypnea, dyspnea, and syncope. To summarize this whole lecture, increased resistance within the heart results in concentric hypertrophy, or thickening of the ventricular walls, while increased volume results in eccentric hypertrophy, or a larger ventricular lumen. Right-sided heart failure is going to result in systemic congestion and edema, while left-sided heart failure is going to cause pulmonary edema and syncope. Thank you for watching PathoLogic, and we will see you in the next one.